The highly anticipated vaccine advisory panel's two-day meeting is shaping up differently than expected. Two words to describe it: chaos and confusion. To begin with, the committee chair opening today's meeting saying, quote, "We are rookies." And second, they're now backing off from any proposed changes to the vaccine schedule for hepatitis B. Scripps News business and tech correspondent Mara Barrett has had the difficult task of following this meeting. And I say difficult because even the members are confused, because yesterday one abstained on a vote saying he doesn't understand what they would be voting on. So Mara, try to sort it out for us.
Well, Del, it was 2 days of, let's call it, unusual meetings. The Federal Vaccine Committee changing the language for recommendations around COVID and MMRV. They also indefinitely postponed that vote on a hepatitis B vaccine recommendation. All of this also calling insurance coverage into question. New recommendations from the CDC's vaccine advisory panel this week leaves COVID-19 vaccine decisions up to each individual. And the MMRV vaccine is now not recommended for children under 4.
The recommendation just simply does not make any sense. And from a public health standpoint, this is a really bad idea.
The combined shot for measles, mumps, rubella, and varicella has been in use for 10 years. And previous guidance began the vaccination process for toddlers at 12 months old. The panel intended to vote on changes for hepatitis B as well, but in a surprise move backed off at the last minute. Health and Human Services Secretary Robert F. Kennedy Jr. handpicked the committee, adding 5 new members as recently as this week, just before the meeting. Some of them historically have been critical of vaccines. The lack of experience clear on Friday as the panel reversed its own decision regarding insurance coverage for the MMRV vaccine. Chair Martin Koldorf self-describing some of the group as, quote, rookies, noting with one exception, this was either our first ACIP meeting or our second. It's led medical experts like Dr. David Higgins and Dr. Jill Roberts to call out a lack of data to back up the decisions.
The committee that's formed right now is not a committee that I am looking to for vaccine recommendations as a pediatrician.
It's not based in science, not based in risk. It's not based in the best things for the U.S. population. That speaks volumes.
Dr. Roberts noted this will likely lead to lower vaccination rates and will impact herd immunity. And furthermore, given how politics have influenced the agency, medical experts in the room who voiced opposition to the recommendation overhaul, and there were many of them during the public comment period, they did so knowing that there could be retribution or a risk to their jobs. Now, these recommendations must be reviewed and approved by the CDC before it becomes official guidance, Del.
So, Mara, not just the doctors who seem to be confused, but also the insurance companies. The recommendations sparking confusion about who is going to pay for what and what insurance will cover the vaccines. What did you hear about that?
Well, while a trade group representing private insurers like Independence Blue Cross, Kaiser Permanente, and Cigna say that they will cover these vaccines, citing an evidence-based approach that doesn't apply to Medicare or the Vaccines for Children program, which have to follow the group's recommendations, which means those families will be likely paying out of pocket, Del.
Scripps News business and tech correspondent Mara Barrett for us. Mara, thank you very much.